Hi, welcome to this video about knee surgeries and what the patients go through the process. Uh, I have been building retirement communities for the Indians called Shantiniketan for close to about 15 years, 14, 15 years, and I have built almost 300 homes. And I've seen many women, especially, that they have to go through a knee surgery because of osteoarthritis. So, this is basically the degradation of the kneecap by losing a lot of calcium in childbirth, etc. So, most of the people who go through don't have any problems, but some people are very apprehensive about the process, the pain, and everything. So, this video is to alleviate the anxiety in those who are very worried about the surgery before the surgery. We are going to be following Mrs. Seema Kapoor, and she lives with her husband Bimal Kapoor in phase 3. So this will be a journey of interacting with her before the surgery, then after the surgery, following up with her at the hospital, and then the physical training, the physical therapy rather, that they have to undergo. Just one word of suggestion or advice I can give you is the physical therapy in the recovery is very, very important. My wife, Rani, has undergone this knee surgery in both the knees a couple of years ago, and she's absolutely fine. She's able to run and dance and jump, no problem at all. But one has to go through the physical therapy exercises after the surgery. So that is the most important thing. It will be painful for the first 2 days because it's a raw wound, but it all, believe me, it all gets better in about 6 to 8 weeks. And then, like, they could never remember the pain that they had before the surgery while walking or standing. Okay, so welcome to the show. Let's go through the details. How are you?
Rani, you can keep it on the table.
Yeah?
Ah.
So you're having some ice pack?
Ice of you, thank you.
Ice pack. Oh, okay.
Thank you. That day you were missing the flowers.
No, we didn't want to bring the flowers because
Because you know,
hospital
it's not
sometimes.
I'm bringing back.
Right. Good, good. You look good. You look good.
I was working from here also.
Right.
In this room.
Yes. That's good. That's good. And only he's here like 2 hours away. So that's very good. That's very good.
Yeah, you are right. He did his part, arranged the helper and everything. This is.
Yeah.
Seemaji, you have to do your part now. That's all. How do you feel?
I'm quite
So,
okay.
okay. So tell us about the day of the surgery. So what happened? What time did he go? Then what happened? Tell us about the surgery.
What time did I go?
We were told to report there at 6:30 in the morning
Okay.
because the surgery was scheduled for 8:30, the first surgery.
Okay.
8:30.
Okay.
So they have to do a lot of
Yeah, pre-prep, yeah.
pre.
They have to start the IV and all that
So
stuff.
8:30.
Huh.
And then in the hospital, there when we went, they gave a number.
Hmm.
They said your patient number is this.
Okay.
And on the screen, it showed the progress.
Okay.
They said this number, this has gone to the operation theatre.
Okay.
Now we're going to the recovery room.
Okay.
Now we're going to the room.
Oh, very, very good.
Room
Huh.
number this.
Okay.
You can go and wait.
I see. I see.
The
Okay.
operation was at 8:30, which is
So it started on time?
9.
must be
It
in
started at 9.
9. Okay.
Because I was not in my senses. 8:30 we went in, but I was anesthesia, there.
Oh, they started the anesthesia at that time itself
Yes.
and knocked you out.
they ask, one is general anesthesia,
Yes.
and one is they will give in the spine,
Spine.
only the lower part.
Yes.
And the spine and lower part is less painful,
Hmm.
and recovery is much faster.
Yes.
So she opted for that.
Oh, okay.
That is what they must have given.
So then you would have been in your senses, no?
No.
No, but still that makes you very drowsy.
Okay. Plus also in the IV they would give you
I think
something
the
to be
spinal
drowsy.
would be
It
more.
makes you very drowsy.
Yeah.
You
Yeah.
don't know what is happening. He has done and he has gone. I don't know anything.
So you went at 8:30. They started, and very soon you kind of
They started 9.
9. But
8:30,
you
I could see all around. I could feel that they have brought me.
okay.
But afterwards,
How was your mindset at that time? Were you anxious or afraid or?
no, I was not afraid.
Uh,
I was praying to God all the time.
okay, good.
All the time.
Okay. Yeah, that's the strength we get. Yes. And then what do you remember next?
Next, when I came to the
You-
senses a little bit,
Yeah, that was in the recovery room. It was. So who was around you when you woke up?
they brought me to the room and then they were all there.
No. In the recovery room, when you opened your eyes, who was there? Nurse
All
or
the other,
patients?
all the other patients and the nurses.
Nurses. Okay.
I could see
The
their-
family was not there.
He was not there.
He was not there.
Recovery room, all the patients and the nurses.
Okay. Did you feel pain in your leg?
No, not at that time.
At that time, you didn't feel anything.
It was all anesthesia. I didn't couldn't
Okay.
feel
Nothing. Okay. Okay. And then when did they take you to the room?
11:30.
11:30, 12 o'clock they took you to the room. Okay. And then, so when they took you to the room, you were awake. Awake. And then you saw them in the room? Bimbalji?
Yes.
So when you went there, they were already there?
They were already.
Okay. Then when did you start feeling any pain?
My pain was, they had shown the
Yes.
pictures. Yellow, green, red, blue. My pain was always on the darker green and the yellow side. It was less
You were in the border, like,
borderline,
okay, painful but something tolerable.
but tolerable.
Tolerable.
They make the pain,
Hmm.
that what are the pains can be done, they are stretches.
Right.
So no pain,
Yes.
little more and intense.
Right. Yes.
Intense is absolutely green.
Right. Okay.
And the first one is absolutely very light yellow.
Very light yellow. Okay.
So they say you point out what is your pain really accordingly. It was somewhere middle, not much.
And after that, throughout your stay, did that pain level move either side, or was it kind of
It was always on the
in the middle?
middle,
In the middle. It was painful but tolerable.
tolerable.
Tolerable. Okay.
They would give me this 10
Oh, 2 Tylenol every 6 hours. But you managed on Tylenol alone.
They did not give you.
Very good.
They
Very
did not
good.
give you any.
and many other
Codeine. Any.
He said, is it pain is more?
So
I
when
said,
did
"No,
you?
it is
So
not."
morning when you went, you wouldn't have eaten anything.
If I had said it is too much,
So,
I would give more at
okay.
night. Nothing, not even
Nothing.
water.
But you managed on Tylenol
They gave
alone.
some orange juice.
Very good.
So when I was going in the car, other medicines they were giving.
Sip the orange juice. And then for the bathroom and morning when you have a catheter have eaten anything.
Right.
So,
after 12 at night, next to my nothing, not even
Nothing.
water.
Okay.
I used to get
So you didn't have a catheter. Okay.
When I was
So
going
not
in the
collecting
car,
the
it was
bag.
not working that.
Sip the orange juice. And then for
But it
the
was not
bathroom
working
and
because
all,
I was
did they have a catheter?
But you won't even know you have the catheter.
They usually put it after you're knocked out. You know, and then when you wake up, it is still there. So you didn't have a catheter because
Bottle is empty.
not collecting
And
the
it was
bag.
not working. Otherwise, I go to the toilet. It was there, but it was not working because I'm not used to it.
No, but because
But you
didn't
won't
eat
even
and
know
drink
you
anything
have the
from
catheter.
night,
They usually put it after you're knocked out, IV fluid, and then when you wake up, it is still there. But because it was not working, but they had it there.
They had it there. Otherwise, I go in like this. I said, I don't know how to ask. Then they put me on.
No, but because you didn't drink anything from the night, then you were able to get anything. You had to get down to go to the commode, or the IV fluid was a bed commode. But you say it was not working, but they had it there.
They had it there. He said, you press like this. I said, I don't know how to do it. So then they put me on the commode. Then a lot of
Right.
I started going to the.
And you were able to get, but you had to get down to go to the make you walk first? It was a bed commode.
It was a little painful.
In the afternoon,
So 12 o'clock you came to the room. Did they give anything to eat?
Was on this side, so I managed to sit on that.
Something soft, juice type, liquids.
2 days I started going to the.
Okay, yeah. But when did they make you walk and things like that?
Something soft.
Soft. And then what time did they make you walk? So 12 o'clock you came to the room. Yeah. Did they give anything to eat? At 2 o'clock?
at 2 o'clock.
2
2
o'clock.
o'clock.
Something soft, juice type, liquids. Nurses station. So the total round would have been about 50 feet,
Something soft.
100 feet, 100 feet. And then what time did they make you walk?
With the walk.
With the walker. Yeah.
And the nurse was holding
At
me
2
like
o'clock? Okay. Yeah, they put a belt around you and did you feel pain? Nurses station. So the total round would have been about 50 feet,
to sit and
100 feet, 100 feet maybe, 100 feet.
with the walk.
With the walker.
So when I sit and the nurse was holding me like this.
Okay. Yeah, they put a belt around you
There's another cushion over
and did you feel pain when you walked? So little. And then when did they give you first solid food?
to sit and get up.
Get up.
No
Okay.
pain was there.
Dinner?
Like this.
No, also when I sit on the dining chair, because my stomach was very difficult.
No. I mean,
Another cushion over
so when you went to the room at 12, then they started giving you something like and then when did they give you first solid dinner? What did they give you?
there. They would ask me, what would you like
Dinner?
to
Okay.
Like this.
Solid?
Yes, they gave you the choice. You had that order sheet with you. I mean, okay. So when you went to the room at 12, then they started giving you something like soup and things like that. Fish, okay. Dinner, what did they give you?
Give me fried fish. I said, no fried fish.
Mashed potatoes,
But she gave me
only
French fries.
liquid. Not mashed potato, French fries, vegetables, no.
That was on the last day. What was it?
Last day, okay. Then in the night, were you able to sleep well?
They started giving food.
To get up.
From morning itself, for the bathroom.
They would ask me, what would you like to
Okay. Yes, they gave you the choice. You had that order commode with you or bathroom.
I had burger also one day.
First day commode only. Okay. And next day morning you woke up at what time? Fish. Okay.
I told her, they don't let you sleep. She said, no friend. 12 o'clock something.
They'll keep coming testing, taking your vitals. Every 2 hours they'll
2 hours they come. French fries. Sometimes they have to
French
give
fries.
for the blood pressure they gave and for this. Then all last day. One
last
at,
day. Okay. Then in the night were you able to sleep
7
well
or 8, and then again 6 to get up. Then 12.
for the
Then
bathroom?
in the morning,
When did they stop the IV fluid?
ring the bell and call the nurse.
When you came to the room, was it still there? Go to the commode or bathroom?
No. First they come out only.
First day commode only. Okay. The water next day morning keeps drops. Woke up at what time? Was it there the whole day?
Yes. They don't let you sleep. They came 12 o'clock something.
They'll keep coming testing, taking your vitals. Saline every 2 hours they'll.
2 hours they
Usually
come.
they remove it after a day or in the
They
night.
have to give you some medicine.
Usually
For
to
the
give
blood
some
pressure
Medicaid
they
because
gave
you would have
and
started
Tylenol.
drinking.
One at
So saline usually is for giving medicines
around
through that,
7 or 8,
painkillers.
And then again 6 and then 12.
Okay.
And then in the morning.
So when did they stop the IV fluid? So was it hooked up till you came home? When you came to the room, was it still there?
I opted for an extra day.
Okay.
Because first I was planning to go to the rehab.
Yes. The water, the saline keeps drops.
Lot of infection.
Was it there the whole day? It's happening in the yes.
It's better you go home. Then they remove. Nurses will come.
No, that they removed, but was the saline there till you
Therapy will come.
Okay. Usually they remove it after a day or in the night.
Give me another day.
Usually to give some medication because he have started drinking because of this COVID situation. Saline, a lot of people are getting medicines through that, painkillers.
Give me one more extra day.
Yeah.
in the hospital.
Many people don't want to go to rehab now. So the
So
second day was how many
hooked up
times did they make you
till you came home?
walk around?
I walked it for walk on my own also.
Okay. Oh, okay.
First time I was planning to go to the rehab.
Yes.
Then Dr. Guru said, lot of
Hmm.
infection
It's happening in the yes.
it's better to go home.
Yes.
Nurses will
I
come
will sick people who have been operated,
for the
their
physiotherapy.
knee or hip,
Okay. Yes.
they will
I said, okay, then give me another day in the hospital.
Right.
They gave me another day.
Yeah.
This way stretching.
Very good at it.
Breathing, did they give you that breathing because stuff? Rehab, that you were able to COVID situation,
Yes.
a lot of people are getting infections.
prevent pneumonia.
Yes.
Give me one more.
That is why many basically
don't want to go to rehab
clears your lung. So the second day was how many times I went through my bypass surgery. Walk around. And because I went through all the surgery thing. Oh, okay. This is simple. Bypass, they opened your heart. They cut me the front.
Don't do yourself.
Okay, yeah, because they want to hold you with the major operation. Because if you fall, it's like crisis, you know. And then, so in the second day,
They were conducting
if they,
I went on Tuesday. Tuesday was the surgery.
yes,
Wednesday, Thursday,
at 10 o'clock.
Friday I came.
okay. So Wednesday, what was your pain level in that chart? Was it still there?
Pain level was always same.
Same, in the
I
middle.
used to get up and sit down. Then only pain.
Right.
They're putting the ball in one big
Walking,
room
no
and
pain.
then, recline
Lying
there,
down, no
right?
pain.
Because I was
Only when
there.
getting up.
But only sad thing is that you have to lie down only straight. This way stretching.
Yeah, you can't turn. Breathing, did they
You
give
can't
you
turn.
that breathing
Turn
stuff?
it is- then you'll-
That you were able to do, yes.
And I am only used to
Sleeping on
Sleeping
this
on the
side, and yes, that is why it
They
basically
don't want it boosted there.
clears your lung.
and if you bend your knee, it pains more.
Because I went through my
Pain and
bypass
then,
surgery.
It's going to go dislocate somewhere,
Because I went through all this. So, however, when did the doctors come to see you? Who all came? Guru came. Plus, they opened your heart to the room. They cut me the front. Does he come every day? Major operation. Major. It's.
On the surgery day, he doesn't come.
And then,
Surgery day, he's
so
busy.
the second day, so he came on Thursday.
I went on Tuesday.
Yeah.
Tuesday was the surgery. Wednesday.
Surgery was Tuesday.
Tuesday.
And Wednesday he came. So Wednesday, what was your pain level in that chart? Was it still there?
Pain level was always same.
Same, in the
I
middle.
used to get up,
So inquired
sit
about
down,
that and then to
then only pain.
then of course
Walking, no pain.
Walking, no pain. Okay. Lying down, no pain. Only when getting up.
But only the sad thing is that you have to lie down only straight. Whatever I-
Yeah, you can't turn.
You can't turn. Turn, he says, then you can have the
Yeah,
appointment
yes.
from him.
It was hard for me. It was,
And
On
I am
Thursday.
only used to
Sleeping on
sleeping on the
side and yes. That's during surgery. That is
because they
one
wanted to keep that heel stand
Thursday.
like that. They don't want
When-
it to
Wednesday.
Yes, yes.
Because
And if you bend your knee, it pains more.
yeah,
Okay.
pain and then it's going to go dislocate somewhere. Whatever they did it.
So, however, when did the doctors come to see you? Who all came? Guru came
Guru came.
to the room.
Okay,
Does he come every day?
Orthopedic.
Guru comes.
he came on Thursday.
On the surgery day, he doesn't come because surgery day is so busy.
Yes. So he came the next day.
Dr. Guru Dhanapal surgery.
Yeah. So he came on Thursday.
Now he came on Wednesday,
Wednesday.
Surgery was Tuesday.
Tuesday.
And Wednesday he came.
Wednesday, myself and son, we had gone for lunch. He came at that time.
Okay.
She was there. So inquired about that and then to wait. Then of course I sent him a message that we missed you.
Okay.
We would like to meet you on Thursday.
Okay.
So
First
Thursday,
day when he came, they were not there.
Yes.
So then
Thursday-
whatever I could manage to ask him, I asked him. Then we took an appointment from him.
Mm-hmm.
Then he came that day specially for us.
On Thursday.
on Thursday, we gave him a message. There was no reply. Again around 4 o'clock, I give a message that we want to meet you.
On
This was on Thursday.
Thursday.
And on Wednesday.
Wednesday.
Then he replied, I've still got one surgery left. And
Okay.
I told him, no, next week is today surgery day, you can't come, but come the next day.
Okay.
Then he came next day. Friday, because Thursday was his Your Tuesdays and Thursdays are the surgery days.
Okay.
From morning till evening. So he came on Friday.
Before you discharge.
He came and met. We waited for him. He came, he spent. Then he gave a little advice. He said, this is a very small thing.
Yeah.
Only physical training what is being done, please do 2 weeks.
Yes.
It will be intensive. But after that, you will have no problem.
Yes.
You should be able to do the physical training. One person came today.
Hmm.
He did that. And he also said, just 2 weeks. Nothing more.
2 weeks every day.
Like 2 weeks of all the extensive surgery will be only for 2 weeks from the date of.
No, the person who comes nurse to see you,
I don't.
will that be every day?
No, we came today, then 3 days a week.
3 days a week.
Wednesday and Friday.
Friday, okay.
But he said, the rest of the time you have to do it.
Do it yourself.
And then not only once, you have to do it twice. And today he said, some of the things I've said you must do 3 times in a day.
Okay.
He said, if you follow this routine, very religiously,
Yes.
you will have no problem after.
Good. Good.
And Dr. Guru also said, Dr. Guru said that you have the pain and you don't do that exercise. That pain will get there.
It will all never go away.
Then it will not go away.
Yes.
Then people will say the surgery was not right. He said, even if you have a pain, please do it.
Okay.
Whatever the physical thing.
And when they come, how long do they stay? For
You
exercise?
were there almost for an hour.
An hour. An hour. And all throughout they make you keep doing that.
That's it. Some lying down, some
So
sitting
we have
down.
to, there is a room where all the patients come.
No, here, after you came home,
It is still about an hour.
about an hour. And all the exercises are sitting down or?
Some are lying down,
Okay.
some are sitting down.
And walking?
Walking.
Walking too you keep doing yourself throughout. Okay.
And then he made us walk with a cane only, not with
Okay.
it. And that also he could do.
Are you able to eat properly now?
Nausea was there
Okay.
last day. They changed the medicine that Tylenol to they gave another one. What is the name?
The chocolate something,
Is it for the pain? Codeine? Some oxycodone, hydrocodone?
That's the main.
Oxycodone. Yeah.
but that I think does not suit her. So she feels Tylenol is better.
Yeah, oxycodone is actually a codeine. So it can become addictive and you will be sleepy all the time with that, drowsy,
Nausea.
nausea.
I went through that and you get a constipation, so you need
Right.
to drink lots of water.
Yeah. How is your bowel movement?
Not nice for the first 2 days.
Okay.
So third day I took my Trifla also.
Okay.
Trifla is the Indian herb which I take.
For your bowel movement.
Every day.
Every day, yes.
So I'm quite
It's
used
like a Dulcolax but herbal.
herbal.
Okay. Yes.
So now I'm then I start. third
Now
day
you are
I-
regular. Now you are regular.
Okay.
Okay. Okay. And so before the surgery, you said you were like this. Now, after the surgery, do you think was there a reason to have felt like that?
I feel it was good that I have got it done.
Okay, give him a big smile.
Whatever
Now it-
apprehension she had at that time,
Yeah.
and the fear complex.
Yes.
Yeah.
That we were completely. She feels it was best that we have done.
Now, had you known this is how it will end up, you would not have been that afraid, right? See, this is what is going to help people watching this. Those who are, everybody will be afraid.
For them, knee surgery is nothing.
Oh yeah,
For them, knee surgery is very small.
yeah. It's very very
For
easy.
them, the heart and all that is
Heart and all is major surgery.
Major.
That's why this is almost done like a day surgery, but they keep you overnight too. A lot of people come the next day.
Yeah, because the other surgeries is organs related. They have to be extremely
Yeah,
careful.
abdomen opening,
Yeah.
anything can happen. Here it's like falling down and getting hurt. And then you go to the doctor, they put some stitches. That's exactly what it is. So would you say yes, that fear was not worth it?
yes, that is.
Seema is ready for another one. Even if
So-
they call for you, come on over.
Earlier time, for
Huh.
2 days we had been talking of operation.
Yes.
So sometimes she had a Saturday. And sometimes ask me too, why do that? I'm already walking on that. Let me continue this. That thought will come. Then she will ask someone else, should he go or should he not go?
I asked Mrs. Subramanian.
Yeah.
Take
Rani's main reason,
Because of the higi, I went for it. How many years I suffered.
I had to push her because she was always in pain. But her main reason to get the surgery done was for dancing Garba.
But another thing, my knee was kind of starting to go this way, very bad. It looked so ugly too, you know.
Looks, they say donkey legs.
Yeah, donkey legs.
From the knee, it opens out both legs.
So I'm happy I had it done.
She was much younger age.
वो तो है, that is there.
She is now 83.
83 is young for Shanti Niketan.
And someone should have done. It's on gauge. Now all those parameters are working well.
Yes,
There is no restriction. This is the right time to do so.
yes.
Irrespective of the age. Age is not such a matter. If other parameters in the body are okay,
Right.
then better to go.
Yeah, Rani is going to go for her eye surgery.
Right.
And cataract.
Yeah.
That is simple.
That is very
We
simple.
got it done in India. Had it, Prabha had it.
I know any kind of surgery, I am really impressed.
So the doctor said, don't worry, you're so young. There are people who are 95 plus want to come and get it done. That's when we start getting worried. You know?
They say it is 10 to 15 minutes, that's it. They say.
It's not even, there's no pain involved. You don't feel any pain. So it's not even like your knee surgery. It's just simple, like your eye test. You go for your eye test for glass. You know.
That's a part of growing up.
I know, yep, that's right.
So this PT person will come 3 times a week for 2 weeks. Okay. When do you have to see the doctor next? Yeah, after the PT is over, physical therapy, after 2 weeks, you go to the office and then schedule the next surgery.
I think it's probably they give it 2 to 3 months. Then you'll be ready.
So now that the surgery is over, what would you like to tell people about the surgery in your own words?
Mrs. Subramanian said it's nothing. Leave it.
Don't worry. How was the hospital, nurses and all? They treated you well?
Dr. Guru, extremely good.
Wonderful.
Very
Very friendly.
type. And I call him my son.
Yes. He's young. Very young. Yeah. Rani, he did for Rani. Everybody, Shantini Ketan.
Shantini
He probably is the only surgeon here who does it, maybe.
I think he has like somebody partner with him too.
Yes,
Yeah.
yes. In fact, he has his partner, I think, or maybe him. They have invented something themselves for the knee surgery. That they put I think platinum or some kneecap.
This is a platinum.
Platinum. So basically, your kneecap is taken out, and then they, how they shave off your end of the bones. They put a cap, and then the cap for both ends of the thing, and then a metal. So when you walk, it rubs only the metal, not like your nerves like before the pain was there. So now you won't feel anything when you walk. Once it's all healed. Now it's cut up, so you feel it. Oh yeah, that's what. Because they've cut, the nerves would have been cut. That is the pain. The actual knee is not the pain. So I wish you will keep talking more as you recover. I will see you next week, and then we'll see how your progress is. And, okay, thank you. Feeling today?
Feeling better, but when the 6 hours of the medication gets over, then I feel like having the medicine again.
Okay.
Every 6 hours I'm taking.
And what medicine are you taking?
Medication is this
Codeine?
Tylenol.
Tylenol. Okay.
500.
So you had the surgery on which day?
11th.
11th.
Last Tuesday.
And today's 19th, huh?
Last Tuesday.
About a week. Yeah.
I have 24th, I have to go to the doctor.
Last Tuesday, today is Wednesday this week. Okay. You have to do the exercise. Yeah. And by then you will feel okay. So for some time you will need the pain medicine. Because, yes. So you continue with your walk, you know. Let him come. When he comes, we'll ask him whether he's willing to shoot him. If not, I will just shoot what exercises you are doing, you know.
Okay, if you get a little tired and like, I want a little rest. You doing okay? All right. Now we're going to do the heel slide. You remember the heel slide. We're going to bend your knee and slide your foot up. Right, so bring it up and then back down. Good. Now when you bring it up, you want to make sure that you're getting a good stretch in your knee. Go ahead, bring it up. Right, and back down. So you don't have to go much further than you don't want to go into the pain. Go all the way up to there and then back down. Good. So you want to feel a little bit of a stretch. Good. Right. This helps you bend your knee when you're walking and you're taking a step. Good. Okay. Very good. Sometimes it feels better the more you do it. It kind of loosens up a little bit. So I think that's what happened there.
This one is too easy.
That was too easy. You're doing good with that. Well, that would look good on the video if you made them think that's the knee. Wow. All right. Now this next one is the one we're going to slide your leg out to the side and back. So it's outside and back in. Right. But we want to try to keep your toes pointing up to the ceiling and out and back in. There you go. Good. You're doing good there. This works the side of your hip or the side of your knee. All right. Guys, their life is improved more and they can do more. It's worth it. The first week or two is a little tough on some exercise, but they get better and then it's worth it.
Yeah, my wife was so scared before. She didn't want to go.
Right.
Then I pushed her. She went for both the knees.
Right.
She's fine. She doesn't complain about any pain anymore.
She had both of them done. Wow.
Both, after 3 months.
Right, 3 months
Yes.
and then had the other one.
Yeah, the same doctor, yes.
Eventually, as we do these, we're going to go with like one hand, and then eventually 2 fingers, and then eventually one, and eventually we'll do it like this, and then we're going to work on balance. For today, we're going to do it holding on. The next one, bend back your knee. So it goes back. Good. But it's like you're going to try to bend your knee more. There you go. And then back down. Good. That's good. And it will kind of make some clicks and pops every now and then. That's okay. Are you okay? Then we'll do the right side on this. So same thing on the good leg, just bending it back and back down. This one is kicking to the side, okay? So remember, you don't want to lean over. You don't want to lean over. You want to make sure you keep from the waist up. You just stand and out just like that. All right, we'll try that. Good. Make sure you stand up tall and not to lean to the right. There you go, that's better. 3. Okay. Now we'll try that same thing on the right leg. Make sure you stand up tall. There you go. Now, a new one we're going to do.
New one.
Okay, this one is called a mini squat. Okay? Mini meaning small. So what you want to do is spread your feet about shoulder width. Alright, about this far. And we're going to bend your knees just a little bit, like you're going to sit in a chair. Okay? Holding on here. So it's make sure that you're not just bending your knee. Make sure that you're sticking the back side out like you're going to sit. Because that's putting the weight through your bottom, but bending your knees. So you don't want to go really far. That's a full squat. This is just a little bit. Now this is good to help you get on and off of the toilet, in and out of the shower, in and out of the car. Let's see you try that. Holding both feet, just spread your feet out. Good. Okay. Now stick your bottom out a little bit more, like you're going to sit in a chair. Imagine you have a chair behind you. Here. Like this. Like you're going to sit in a chair. Imagine this. Now, if you were going to sit in the chair, you would stick your bottom and bend at your waist more. There you go. And then back up. There you go. Keep your back straight. Okay. Now, I'm going to take the chair out, so don't sit, okay? Go ahead and stand back up. All right, you good? Okay. Now, straighten your back a little bit. All right, that's good. You can rest. All right, my waist and coming up. If you don't do that, it's going to be hard on your knees a little. Make sure that you're like you're going to sit. That's called a mini squat. Lying down and standing. Now we're going to do the standing. So we're going to go up to your tiptoes like this, and then back, and then lift your toes up. So back and forth. There you go. Good. Up. Good. This is really important for balance. Good. Okay. So those. Okay. So I've added a couple new ones. When I come back Friday, I'm going to add some more. We're going to go a little bit every time, okay? All right. So what we're going to do, we can take a little bit of a break if you'd like, and then we're going to work on walking a little with the cane, a little bit more. All right. To the left leg. And remember how we walk. I'll tell you what, let me grab a, let me get a belt, just in case, okay? Up there. Okay. But I really don't need it, but if for some reason you lost your balance, I got something to hang on to. Okay, let's head on outside. We're going to go down the hallway a little bit. You're doing so much better now with the cane with the left. Good. Right, when you're by yourself. You okay? There's one other thing we're going to do with your walking and balance, but let's take a little break. All right, how about we go right here to the chair? I'll move this out. All right, that was very good. Some balance this exercise. Now what we're gonna do, don't do this on your own. This is only with me here to work on your balance. So if I can make it hard with me here, then it's gonna be easier on your own, okay? So let's see, I'm going to get some cups here. Okay. See how good you can drive with your walker. All right. Front. Have it out in front a little more than normal. And with your left leg, just work on picking up over. See that? And then walk it. And that. So it's like this. Working on bending your knee more. Okay. We'll start behind this one. Alright, so have the walker out in front a little further. Alright, so do you remember that exercise we did over here where I had you lift your knee up? Try that right there. Try to lift up.
With the right foot first?
The left one. Up and then over. There you go. And then the right one. Okay, try to go over top of it. Okay, that's better. Just like you're marching. There, look at you. Yes, you got it now. Just better than normal that you would pick your foot up, but it teaches you a good lesson. Let me get out of your way here. Look how much better you're doing. Look at that. You got it now. Yes. How are you feeling? Good. Let's do it one more time. There and back. Then we're all done. And make you get ice in your leg. Now see, that was better than the first time. There you go. Good. Now this will make regular walking much easier because it's not going to be this hard. There you go. Yeah. Okay. You can just go back here. We're all done. We'll put some ice in your leg. She had therapy for a few days at the hospital. And then she has home therapy for about 2 weeks. And then she'll go to therapy out of the house for about 4 weeks. And that's called outpatient.
Outpatient,
therapy.
yes.
And that's where they may get her on some equipment and some machines. And that'll be through the doctor's office there. So that'll be about 3 times a week for about 4 weeks. Right. Well, for the therapy there. Now, sometimes it'll be through the doctor. Sometimes the doctor will have therapy there at his office. Other times he has you go to a therapy center that's close by where you live. And they all know what to do with the, each doctor has their own orders and they follow that. So that'll be good for you. So next week will be my last week with you already. Because then you go out of the house. And I'll be sad. Just when you start doing good, I gotta let you go. Yeah, and you know, we may want to get that bigger pillow. Or, you know, it just as long as it's, you feel okay, because it doesn't, we can even have both of them, as long as you're flat. Okay. See, that may be better. Woo! How's that? This is the best thing I've done all day. This is your favorite exercise. Just sitting and putting ice. All right. So for this, you can just let it go for about 20 to 30 minutes and just rest, okay? I put the new exercises here. Now while you're sitting, I'm going to check the blood pressure again because it was a little high last time. But you can leave this on. Slide this on right here. Here we go. Alright. Very good. And they borrow your finger. There we go. Okay, you can relax there. oxygen. Your oxygen level is good. Are you in much pain? Okay. Sometimes it'll hurt more than others. Some people complain of more soreness when they first wake up in the morning, when they're laying for a while. Okay, so 150 over 76. So it's still up a little, but it's okay. Nothing too bad. 150 over 76. Here.
So Seema ji, how do you feel after the exercise? Now with the ice, it's good.
I should put and we are relaxing now.
Relax. Good, good. So Seema ji, you feel good enough to come to the clubhouse now. Just about a week after surgery. Oh, it was an effort?
Very good effort.
Yeah? Yeah, I saw her doing exercise yesterday. Really, really good.